What's up, everyone? My name is Dr. Antonio Webb. I am a fifth-year orthopedic surgery resident. I'm a chief resident. Today, you're going to be hanging out with me to see what it's like to be a surgeon.
Oh, good morning, everybody.
So it's about 5:30 a.m. I just got dressed. I'm about to head to the hospital. And round with my team. Rounding is when we come together as a group of doctors and we go see all of our patients in the hospital. So when you see large groups of doctors walking down the hall early in the morning, that's rounding. As a chief resident, my role is to make sure that patients before surgery and also after surgery are being managed appropriately, which means their labs are checked. We give them blood if they need blood. Checking x-rays, we're checking labs. In the hospital, everyone works as a team. So I can call the internal medicine doctors, I can call the general surgeons if I have a problem. If I think a patient needs to be seen for their ear, I call the ENT doctor. So we work as a team, and part of the team, we have medical students on our team. Everyone works as a team. About to head to the hospital, round with my team.
Okay guys, we're at a meeting right now and they have breakfast for us. So I just got finished with morning report where we talk about all of the patients of the day. That seems to be something that's common in all my rotations. We have like these meetings and talk about patients and get faculty's opinion before we discharge them or do what we need to do. Now I'm going to go back to the trauma room. Trauma is interesting. How it works is we have like this bay area and people come in stretchers and we stabilize them, take care of them, keep them for a while, and then send them either home or into the hospital. And we get a lot of things like gunshot wounds, people falling from ladders, a lot of motor vehicle collisions, unfortunately, and assault, which is pretty sad. A lot of stuff that we see is pretty sad, but interesting nonetheless. This is where the ambulances come in and where patients come in kind of through here. And I'm gonna go back to work, so.
Depending on the day, we have lectures. Residents, we still have lectures that we go to, taught by our staff.
We're on an official meeting.
And then after lecture, we go to surgery. We operate until, surgeries are done. Some days we have 4 surgeries, some days we have 5, some days we don't have any. Today we have 2 knee replacements, which means patients who have arthritis of their knees, failed everything else in terms of injections, physical therapy, will be replacing their knees with basically metal parts. We use saws, we use hammers, we use mallets, screws, plates. It's a lot of fun. You guys are gonna hang out with me today, and hope you enjoy it. On the team here at the VA, we have 2 third-year residents, a second-year resident, and I think 4 interns. So as a team, we work together to take care of the patients that are in-house. It'll be 3 of us in surgery with the surgical tech, as well as with anesthesiologists and the OR nurse. So should be a good day today. So we just finished our first knee replacement. We wear these things on our head here, these helmets that have a light on them to help us see in surgery, and essentially these space suits to protect us from bodily fluids. But I have this helmet on here. We have 1 more knee replacement today, and then just seeing patients in clinic and then whatever comes into the ER. So checking with you guys soon. We just got done with our 2 surgeries for today. It's about 4 p.m. Now I just basically put some pain meds and orders for patients that are just had surgery, or usually one of the junior residents. Take care of that. We'll check on them in a couple hours to see how they're doing, and then if they're able to go home today, which very few surgeries that we do, patients can go home. But most of the time they stay in-house, especially a knee replacement. The patients that stay in the hospital, that's when we'll see them the next morning. We'll round on them as a team. And then for a knee replacement, they're usually here for 2 to 3 days. Other surgeries that we do, shoulder surgery here at the VA, hand surgery, foot and ankle surgery. So all different types. We just have a lot of joint replacements to do here in the next couple of weeks. So I am here in clinic. In clinic we have a procedure room where we do procedures for orthopedics. Patient comes in with a bone that's out of place. We can put it back in place. We use this little x-ray machine here to help us look at the bone and make sure it's in an appropriate position. We have an ultrasound here. We have finger traps, which means their fingers go in here. And it's called Chinese finger traps, and it holds the fingers in place where we can position the arm or reduce a fracture, put a fracture back in place. We have x-ray lead, light. So this is where we do our procedures right here in clinic. All right, so it is about 6:30 p.m. I just got home, pulling into home from work. Today was not a bad day. We did 2 knee replacements. I went to clinic after that. Clinic is where we see patients either before surgery, we see them as consultations, or after surgery. It's called a post-operative visit. And basically we just check their wounds, give them antibiotics if they need, certain pain meds. We order certain diagnostic tests such as a CT scan or an MRI. My role as a chief resident is to make sure that the clinic runs smoothly. And this role is a little bit different depending on where I'm doing the rotation. At the VA, there's a lot of autonomy. So our staff are present if we have questions, but the majority of the time it all falls on me if there are any problems. So I have lots of junior residents that I must make sure that they're doing appropriate workups for patients and seeing patients in a timely manner.
Yeah, I did. I found it.
That's how the day usually runs. We usually get there around 6 o'clock in the morning. We see our patients that are in the hospital. We go to surgery starting at 7 or 7:30 or so, and then surgeries sometimes last to the afternoon. And in between surgeries, I go to clinic to help the junior residents that are in clinic, see if they need any help seeing patients. On this rotation here, I don't have to take a lot of call as a chief resident, compared to a medical student who may be on call for, I don't know, every 3 days, 4 days, and their surgery rotation.
I just finished a 24-hour shift. It's nothing but me and this long walk and my long drive home to Sweet Salvation. Sleep and lots of food. Probably food first, then sleep, then more food. Dear God, it is cold right now. It is 29 degrees right now. Could this day get any more just miserable? Hey guys, I just finished my 24-hour shift, and as you can see in my dead eyes, I am like, I'm on another level of tired.
That's kind of what concludes my day. Now I go study.
Alrighty, officially leaving the trauma room. Let's go home.
Even after working 60 to 80 hours a week as residents, we still have to study because we still have exams. Every year, in November of every year, we have an 8-hour exam covering anything in orthopedics. Study and read, at least 2 hours. So even if I'm working 14 hours a day, I try to at least get 2 hours of studying in. And as a medical student, I think it's important to always have something to read during your day, whether this is a book or some questions or Q bank, because there's a lot of downtime, and use your time wisely.
I'm gonna take a quick nap.
Those time management skills will come in handy when you're a resident, because when you have less time and more things to do in a shorter amount of time. So just got home, about to study.
We're low O2. Smoking cessation.
Okay Okay guys, now doing a little bit of homework on UWorld.
It's about 6:30 or so. Study to about 8:30. I might go to the gym for 30, 45 minutes and then call it a night, and we start over tomorrow.
All right, I wake up at 5:20, so I get almost 5 hours of sleep, which is okay. And yeah, I wear a retainer, please don't laugh. Good night, everyone.